Good morning. Today's class is on the drugs which affect uterine contraction or drugs acting on the uterus. Two things can happen to the uterus. It either can contract or it can relax. Accordingly, the classification of drugs acting on the uterus are divided into two. The first group are called the oxytocics because they mimic the actions of oxytocin, that is, these drugs cause uterine contraction. In this group, we have the ergot alkaloids, ergometrin and methyl ergometrin. Then the hormones, we have oxytocin, 1-amino monocarboxytocin, also called carbitocin, and the prostaglandins, PGE2 and PGF2 alpha along with misoprostol. So oxytocics are drugs which cause uterine contraction. Then the second group are called tocolytics. These drugs cause uterine relaxation. In this group we have the beta-2 agonists like ergot, isoetherin, isoxytocin, terbutaline, and also include salbutamol. Among the calcium channel blockers, metolidine is used as a tocolytic. Osmotic agents, namely magnesium sulfate, is a tocolytic, and very recently an oxytocin antagonist named atosiban has come into use. Now oxytocin can be a 3 or a 5 mark question in exams. Oxytocin chemically is a cyclic nanopeptide, meaning it has 9 amino acids synthesized in the hypothalamus and transported to the posterior pituitary for where it is released. It has a plasma half-life of 3 to 10 minutes. Oxytocin acts through G protein coupled receptors, thus causing uterine contraction. Now the action of oxytocin on the uterus is not uniform in that it also stimulates the release of PGE2 and PGF2 alpha and leukotrienes, which are also uterine contractants. Like I said, the action of oxytocin on the uterus. The effect is more prominent on the fundus than on the cervix. So the fundus contracts more vigorously while the cervix relaxes. So this facilitates the expulsion of the fetus. As pregnancy progresses, the sensitivity of the uterus to oxytocin increases almost 8-fold during the last 9 weeks of pregnancy. So the basic role of oxytocin is to terminate pregnancy at term by contracting the fundus and relaxing the cervix. The fetus is expelled. Coming to the therapeutic uses of oxytocin. Induction or augmentation of labor. This is indicated for women who are at high risk if pregnancy is continued and delivery is delayed. Some of the indications include post-maturity, premature rupture of membranes, RH incompatibility, intrauterine fetal growth retardation, maternal diabetes, preeclampsia, antepartum hemorrhage, chorioamnionitis, and along with ergometrin, it is used to control postpartum hemorrhage. Des-aminooxytocin is a synthetic analog of oxytocin. The advantages are it can be given as transbuccal and transnasal formulations. Des-aminooxytocin is indicated for induction of labor, uterine inertia, also postpartum to promote uterine involution, and inefficient milk ejection during postnatal period. That is, after delivery, the mother is not able to eject milk. So des-aminooxytocin is given by the transnasal route. And des-aminooxytocin is also used to control postpartum hemorrhage. Carbitocin is a structural analog of oxytocin with a long plasma half-life of 85 to 100 minutes, compared with the 3 to 10 minutes of oxytocin. Can be given both intravenous and intramuscular. Given intravenous as a single 100 microgram dose, over a minute it is used in the control of postpartum hemorrhage following elective or emergency cesarean section. Please note, carbetocin is not used for induction of labor. Ethacridine is a synthetic dye. Acridine is a dye. Ethacridine is a derivative of acridine which has both antiseptic and uterine stimulant actions. It is administered by the extra amniotic route as a drip of 1% solution along with spartine sulfate using an indwelling Foley's catheter over a period of 10 minutes. It is mainly used for mid-trimester medical termination of pregnancy. Prostaglandins are an important group of oxytocin drugs. PGE2 and PGF2 alpha. They cause uterine contractions and they also sensitize the uterus to the actions of oxytocin. Now, the difference between prostaglandins and oxytocin is, with oxytocin, as pregnancy progresses, the sensitivity of the uterus to oxytocin increases. Whereas with prostaglandins, irrespective of the duration of pregnancy, even small or minute quantities of prostaglandins cause uterine contractions. And this is the reason they are used as abortifacients, that is, termination of pregnancy before completion of term. Prostaglandin E2 and prostaglandin F2 alpha are used to promote coordinated contractions of the uterus while relaxing the cervix. So when does this come into use? Because ripening and softening of the cervix when administered intravaginally. So these prostaglandins, PGE2 and PGF2 alpha, are used for medical termination of pregnancy, also to evacuate the uterus after a missed abortion and to treat hydatidiform mole. The commonly used ones are dinoproston, which is another name for prostaglandin E2, carboprost, which is PGF2 alpha, and misoprostol. The ergot alkaloids are derived from the fungus Claviceps tortulia. They have a varying degree of uterine stimulant or oxytocic action. Ergonovin and or ergometrin are the most predominant ones. The ergot alkaloids act through the 5-HT2 receptors of the uterine smooth muscle. Ergonovin is preferred for control of postpartum hemorrhage and is given immediately after birth. That is, it is administered after the expulsion of the placenta, because if it is administered before placenta is expelled, the placenta may be retained in the uterus. The reason being, ergonovin causes global uterine contraction. Both the cervix and the fundus will contract. The dose of ergonovin and methyl ergonovin or methyl ergometrin is intramuscular or intravenous 0.2 milligrams. Next, coming to the tocolytic drugs. So, tocolytic agents are drugs which cause uterine relaxation. Now, these drugs are mainly used to delay the onset of labor. So, this delay the onset of labor is indicated when there is preterm labor. Now, what is preterm labor? It is the presence of uterine contractions of sufficient frequency and intensity prior to term, that is between 20 and 37 weeks. These are some of the causes of preterm labor: residual hemorrhage, fibroids, uteroplacental insufficiency, systemic bacterial infections, and uterine distortion. So in such cases, labor has to be delayed so that the fetus can complete its duration of term. The commonly used drugs in treatment of preterm labor or delaying labor include the beta-2 agonists like terbutaline, ribitol, isoxazoline, and salbutamol, calcium channel blockers like nifedipine, osmotic agent like magnesium sulfate. Very rarely indomethacin has been used, but the most widely used one is atosiban. So in this chapter, we have learned about drugs which cause uterine contraction, which are called oxytocics, which included oxytocin, desaminoxytocin, carbetocin, the prostaglandins. Then we have the tocolytics or uterine relaxants, like the beta-2 agonists, nifedipine, magnesium sulfate, and atosiba. In the next session, you will be given an assignment on drugs acting on the uterus. Thank you.